Hi everyone, welcome back to my channel. In this video, we're gonna talk about complete bed rest after episode of back pain. When I'm saying back pain is a general term, you could have disc bulges, disc herniation, spinal stenosis, you could have anal tear, or just have sciatica symptoms due to a back spasm. Whether should you ever take complete rest as part of your rehab plan or not? The short answer is no, you shouldn't. And I'm going to explain for you in this video why you shouldn't take complete bed rest. And beside that, if you can't do any activity or exercises, I'm going to share with you 5 different exercises that you can do by the end of this video in bed while you taking care of your recovery and you're not trying to aggravate your pain, but you're still staying active in bed with these 5 exercises for your recovery. If you've never been to this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe to my channel for my weekly update, and don't forget to press that like button. Let's get started. All right, guys, in this video, we're going to talk about complete bed rest, which is used to be a common recommendation from your GP, your physios or chiropractor as a part of your recovery plan after an episode of lower back pain. But current evidence and research, it has shown that unfortunately complete bed rest can have many side effects and it does not necessarily help you for quicker recovery. We're going to cover a couple of tips here that can give you some feedback why you shouldn't rely on complete bed rest. The first thing that complete bed rest does to you, it can cause basically muscle atrophy. Lying in bed for an extended period of time can cause muscle to weaken and basically waste away. This can actually make the pain worsen and delay your recovery. As a part of your recovery, we always recommend our patient to stay active as much as they can, and movement in general can be a work and analgesic, which means it's work like a painkiller, which it's pretty interesting how it works. It technically distracts your nervous system from the pain that you are basically feeling, and with movement you can actually have a quicker recovery. The second thing that complete bed rest does, it can cause a stiffness. Staying in bed for too long can cause your muscle and joint to become stiff and inflexible. This can make it harder to move around and increase your pain. In reality, this is something that's very common. I've had many patients with chronic lower back pain that they've been suggested to take complete bed rest for a month, and that made their body very stiff. And when they start to move around with any type of movement that they were doing, they would feel pain and discomfort, which means definitely try to stay active as much as you can. And in this video, I'm going to share with you a couple of things that you can do in bed while you're experiencing lower back pain. The next side effect of complete bed rest is that it can simply create your pain to a chronic lower back pain, which means if you're suffering from an acute lower back pain, the simplest way that you recover is to figure out what are the activity or things that you've been doing that bothers your lower back pain, stay away from them and stay active with those activities that helps you to move around and feels good, and gradually build up your recovery to basically getting pain-free and get back to your life. But if you take a complete bed rest and basically only masking your pain and try to really protect your lower back pain from movement, you may feel better for a couple of days, and as soon as you go back to your daily activity, after doing something that you've been protecting for a long time, you can get another flares up and get sore again, and having that loop of basically complete bed rest again and again and again. This is something that is very typical with my chronic lower back pain patient, that they've been had episodes of lower back pain over time, but they never had a clarity what is the cause of their back pain is, what is the action plan, and what they have to do in a daily day-to-day for their recovery in the long run. And they basically, from one episode of back pain, their pain has become chronic lower back pain, and they're very panicked with it because whatever they do through the day, it might aggravate their symptoms, because in chronic pain your back become very protective based on not necessarily tissue damage, but based on overprotection and your behavior. In that sense, I would highly recommend you to stay active after an episode of back pain, and in this video I'm going to share with you what you can do even in bed. The last tips that I would like to share with you guys in regards to complete bed rest is that unfortunately complete bed rest can cause an anxiety, stress and depression due to lack of movement and activity. Our body releases certain hormones and happy hormones when we are active and we move, and these hormones are related to the intensity and activity that we do in day-to-day living, which means we're not doing anything and staying in bed and just resting. Those hormones are very passive and they're not getting activated because you're not moving, and in that case you can simply get depressed and you can easily increase your anxiety and depression by staying in bed. And beside all of these, you could simply feel that I can't do anything, and with having that image and picture in your head that I'm not able to do things and feel a little bit kind of disabled, you could increasing the chances of getting depression and a higher anxiety level, which I would highly recommend to stop doing that. If you're suffering from lower back pain, staying active is very crucial. If you do need help, where you should start and what you can do, I help all of my clients online all around the world with very simple concept and basically rehab plan that you can start at home without any equipment, and I would be more than happy to help you if you need any help. I will leave a link below and you can get more information. Now what we're going to do, we're going to move on through the exercises. These exercises are going to take you 5 minutes daily. You can do them simply without any equipment in bed. Let's get started. All right guys, the first exercise that you're going to try in bed is going to be basically a knee tuck, which means we're going to bring our knee down to our chest, which is simply can help you to stretch and move your hip muscle. We're going to start with this side. And we're going to go through the range that it feels comfortable. You simply want to lie on your back, relax your back, hold the knee from the top, or if it doesn't feel comfortable, you can hold it at the back of the knee. Just bring it to the basically chest. Hold it there, within the range that feels comfortable. Breathe in and out for 10-15 seconds. And when it got more comfortable, you can push it a little bit more higher. And you basically want to get a nice stretch around your hip. If you find this is easy, you can simply bring this knee a little bit toward angle to the opposite shoulder and rotate a little bit. That's going to come off the ground, and I can feel a huge, nice stretch around my hip. This simply going to move around my hip muscle and stretch it. You're going to try the same thing to the other leg. You're going to bring the other knee up, hold it there, breathe in and out. 10-15 seconds, within the range that feels comfortable. You can do it from underneath of the knee. If you have a sore knee, sometimes that can be annoying. Now what I would do after a few seconds, I just rotate a little bit towards the left shoulder, and that give me just a bit of movement around my hip. When I got comfortable with this movement, I bring both knees and hold them just like that. And I focus on my breathing, and I try to do a bit of rocking movement, which means that movement can hugely help you to move the back. My lower back is already off the ground, which is a good thing. I try to rotate to the right and left and breathe in and out. Now, one thing that you want to really focus is your breathing. You want to really focus on your breathing, breathe in and out. Try to avoid your basically your breath, and try to go through the within range that it feels comfortable. You want to practice this exercise for 3 sets of, let's say, 4 to 5 repetitions each side, and hold them for 10-15 seconds. We're going to move on to another hip exercise movement, which is, we call it hip drop. And in this movement, I'm going to show you in 2 different angles that you can have a better view. You're going to lie on your back. You want to open up your both arms next to your body, and you want to keep your knees together and simply drop the knees to one side. You want to hold them there for 10-15 seconds, breathe in and out. Take a deep breath in through the nose and breathe out through the mouth. And you want to do the same thing on the other side. You can simply get a crack around your lower back, which is totally fine. It can be very nice and comfortable. If you find you can't go that far, go through the range that feels comfortable. You can put pillows around each side and try to support your knee to the point that feels comfortable. Now, the more comfortable you got, you can actually do these a little bit quicker, which means you're gonna go to the right and left rather than to just holding it. You want to create movement. This rotation really ease off the lower back and helps you to gain movement, mobility, and it can actually help you to reduce pain. Breathe in and out while you're doing this, and practice this for, let's say, 3 sets of 8 to 10 repetitions. Now, while you're doing this exercise, guys, one of the questions that many of my patients ask is that, can I use hot pack or ice? You can definitely use either of them based on how you feel, which means if you find heat and basically hot bottled water helps more, you can apply that around the lower back, an area that it feels sore, and it basically helps you to feel better, or ice. Both of them are interchangeable and you can try them through the day. All right, guys, we're gonna move on to nerve glide, which is a very simple but effective exercise. If you're having a symptoms of sciatica pain down to your leg, which means it is very common things that you could have, which means if you have a lower back pain, it might actually radiate down to your leg and have a symptoms of sciatica. It might not necessarily be related to disc, but you may have those kind of symptoms. I'm gonna share with you how to improve that with one simple exercise that we call nerve glide. You're gonna lie on your back, the affected side that feels more kind of radiation, you can try it. You can try it for both sides, but mostly on the affected side. You want to bend the knees down to your chest, not very high, through the point that feels comfortable, and you hold them very gently, and you want to come up to basically extending your knee to the range that feels comfortable and back. You want to breathe in and out and practice this movement for 3 sets of 8 to 10 repetitions. This movement can simply help you to improve that tingling or numbness sensation down through your leg. And if you don't feel comfortable to bring your knee up to here, you can use a belt, hold that in that position and gently move it. Or use a towel. This exercise can be done in bed, simply, and it can hugely help you with that tingling sensation and sciatica symptoms down to your leg. You can practice for both sides. Try it for 3 sets of 8 to 10 repetitions each side, as often as possible through the day. All right, guys, we're gonna move on to next exercise, which is prone thoracic rotation. This exercise can help you to open up your upper back and help you to move and get more rotation in your upper back. If you're suffering from lower back pain, disc bulges or sciatica, rotation can be hugely aggravating your pain, but you don't want to run away from it. You want to basically modify the activity and try to keep regaining that movement, because that can hugely help you with your recovery. You're going to lie down on basically right side. In this movement, we want to try to bring the knees kind of like parallel together, like almost 90 degrees, hands straight. You want to go rotate to the opposite side through the range that feels comfortable. I'm going through the basic range to the point that feels good, and I don't let my knees to come up. Try to hold this up here. You can feel huge stretch and movement on my upper back and actually in my lower back. And I come back forward, stretch forward, back again. Breathe in and out. Your neck, follow your hand. Stay there. And breathe in and out, and forward, open her up. Now, if you find in this position your knee doesn't feel comfortable, you can apply a pillow or towel between your knee. Like I have a towel here, I wrap that, let's say here. If you have a pillow in bed, you can simply just hold it like that, just to give it a bit of support, and it actually feels good. You can squeeze these two knees together while you're doing the rotation. Up, yep. This feels much better. Breathe in and out. And you want to rotate it forward. Now, to do the other side, I'm going to just move this way. You don't necessarily do that. You can simply twist. I'm going to move now that way, all the way as far as I can. Relax my arm and bring it forward. Move a little more forward. Open up my arms. Yep. Breathe in and out. Squeezing this towel here together and coming back up. Now, how many times you want to try this? You can practice this exercise for 3 sets of, let's say, 5 each side, and practice it through the day. Now, this exercise should be done daily at least 2 to 3 times through the day for optimum results. We're going to move on to the next movement that you can try in bed, which we call it back extension or normal cobra movements. And you're going to be lying on your basically abdominal or belly, hands next to your armpit, and you're basically trying to shift your back up off the ground. As you can see, I'm going through the range that feels comfortable. So back down. This movement can be done simply to the range that feels comfortable. You don't need to go overdoing it. And I'll put it as part of the last 2 exercises to try, because in some cases, when you try back extension, you might find it slightly can aggravate your symptoms. For that matter, you're starting with those first 3 movements. This can help you to actually neutralize the pain. If you find it helpful, go through the range that feels good, hold it there for seconds, breathe in and out and back. You're gonna practice this for 3 sets of 8 to 10 repetition and try it 2 to 3 times through the day. Now, back extension can be kind of like a little bit challenging if you feel uncomfortable on your belly. You can put a pillow underneath of your belly if you find that it's comfortable. Move around, adjust yourself comfortable, and get comfortable in bed and try it through the day. And this can hugely help you if you specifically are suffering from disc bulges or disc herniation or sciatica pain. This can be a very helpful movement that can reduce your pain and improve your mobility. All right, guys, while you're following this exercise, I would suggest you to follow a couple of simple tips that can hugely help you for your recovery. The first thing is that try to figure out what are the activities that bothers your back and avoid them in a very acute phase, and slowly, gradually get back to them and try to move around the range that feels comfortable. The second thing is that try to go for a short walk as often as possible, which means movement is hugely energetic, which means helps you to reduce your pain and helps you to increase that movement and mobility and trust your low back pain. And I would suggest my patient to go for a short walk. It can be as short as 200 meter, 300 meter, and gradually build up that mileage. And the third things that I would like to share with you guys to be very consistent with these exercises. You have to follow this exercise daily as often as possible for a quicker recovery. If you had any issue with following these exercises and you find them difficult, leave me comments. I can give you modification if you need that. If you need further assistance, I would be more than happy to help you with a customized rehab plan that suits your need and get you back in action with very simple and effective method. If you haven't subscribed my channel yet, make sure to subscribe, share this video with your friends and family who may need this information. Thank you so much for your support and all the message and recommendation. I'll see you guys in the following week. All the best.